The DuPage Federation on Human Services Reform has created this PowerPoint presentation to provide a brief overview of some of the public benefit program changes that have resulted due to the COVID-19 public health emergency. It is important to note that the information contained within this presentation is current as of April 27th, 2020. Today's content will focus primarily on the state benefit programs of SNAP, Medicaid, and unemployment. It is helpful to remind viewers that state benefits within Illinois are administered by a number of different agencies, and we would like to review those roles here. The Illinois Department of Human Services, also known as IDHS, is the agency responsible for processing Medicaid, SNAP, and cash assistance applications. When a customer submits an application to the department, the Illinois DHS caseworkers are the ones who will respond to those applications, communicate with customers, and notify them of their decisions. The Department of Healthcare and Family Services within Illinois is the state agency that oversees Medicaid. This agency is responsible for Medicaid program policy. They are also responsible for contracting with and reimbursing providers, such as healthcare providers or the managed care organizations. Illinois Department of Employment Security, or IDES, is the agency responsible for overseeing and administering unemployment insurance within the state. Before we move on to the content of program changes, I want to point you to these two websites for the most current information when it comes to state policy on public benefits. The Department of Human Services has set up a coronavirus webpage and includes notifications to providers as well as customers. And then the Department of Healthcare and Family Services has a webpage also with a number of program policy changes, but also the status of their requests to the federal government regarding regarding Medicaid. Let's start with a brief update about operations at the Department of Human Services. As of today, the Department of Human Services local offices are still closed to the public. These are often referred to as Family Community Resource Centers, or FCRCs, and these are the local offices that customers may go to for interviews or if they have a problem with their case, or even if they want to apply in person. So at this time, these offices remain closed, and the department is encouraging customers to apply online or to manage their benefits through the Manage My Case option through the online portal at abe.illinois.gov. Customers may also try to apply over the phone at the number listed here, 800-843-6154. But please be advised it is likely that they will encounter significant wait times. The state is allowing verbal consent for telephonic signatures at this time so that applications may be done remotely. When it comes to providers such as yourselves, there are some differences when it comes to Medicaid or SNAP, and I would point you to the department's websites for more guidance about that. But if a DHS caseworker is taking the application over the phone, they are able to also accept those telephonic signatures. If you as a provider assisting clients run into issues or an urgent case situation and you're having a hard time, or your client is having a hard time getting through, you may also try to contact the urgent call teams that have been set up for DHS local offices. And you will find numbers for these teams online at the department's website listed here. The department has also set up a Help is Here toll-free hotline, and that may be another option for you or the consumer, the client, to contact. At the end of the presentation, I'll give you another resource through Help Hub, which if these systems are not working, and again, you have urgent issues or questions, you may try to seek advice there. Again, I will share that at the end of the presentation. Let's talk about a few of the program changes related to SNAP. One of the first changes that has been made is that the SNAP interview requirements are currently waived if the caseworker is able to verify all of the information submitted on an application. I would advise, if you are assisting consumers with these applications, to submit all proofs, including proof of identity and proof of income, at the time of application, because that way the state caseworker does not need to conduct an interview to approve the application. In addition, they have extended the recertification period for SNAP recipients who were due to expire, their benefits were due to expire either in March, April, or May, and their recertification period has been extended for 6 months. Another program change is related to the Able-Bodied Adults Without Dependents, or ABOD program. This is a policy that was in effect in Cook County and DuPage counties. It's been in effect in DuPage County since January of 2018, but more recently went into effect in Cook County just this January of 2020. During the COVID-19 public health emergency, the work requirements for this program have been suspended. The way ABOD works is that if someone is not working or not in a job training program or does not meet an exemption, they're only able to get SNAP for 3 months out of a 3-year period. They have to be meeting these other program requirements. So due to COVID-19, this has been suspended for this time. I think what is important to note for SNAP recipients in DuPage County who maybe lost their benefits at any time in the last 2 years due to this work requirement, they should reapply now, because while the emergency is going on, they may be able to get that SNAP benefit for this time. There's also 2 other SNAP program changes I'd like to talk about, but I have come up with a couple of slides about that for you. So let's talk about emergency SNAP allotments, as well as this new to us PEBT, or Pandemic EBT program. Emergency SNAP allotments were distributed in April and will be distributed again in May. And this is for SNAP households who were not receiving the maximum benefit amount for their household size. For example, a single person on SNAP, the maximum they could receive per month is $194. However, if their net income was at a certain level, they may not receive that full $194. You will often see people maybe receiving $16 a month, or any numeration between or up to the $194. Again, that's for a single person. So what the emergency SNAP allotments does for the month of April and for the month of May is bring that up to the full benefit for those households. It will apply to all existing SNAP recipients and then any new applicants who were approved to receive SNAP during April and May. At this time, we do not know if that will go beyond May, so stay tuned or check the DHS website for more information. Pandemic EBT, or PEBT, is a food assistance program for families with school-age children who were eligible to receive free or reduced school lunches and have lost access to those meals due to the temporary school closures. The benefit that people will receive for PEBT is the value of the school lunches, and so it's listed here on the slide. The benefits will equal about $3.50 for lunch and $2.20 for breakfast per child per day for 7 designated days in March and then 22 of the school days in April. Households who currently receive SNAP will see the benefits automatically deposited on their link cards. Those who are not receiving SNAP will have to complete an application. And as of Friday, as of Friday, May 1st, this application just went live, and you can find more information about the PEBT program on the DHS website. Let's shift gears now to Medicaid. So some of the changes that are being enacted at this time, the state is allowing self-attestation on applications. So what that means is very similar to SNAP. They're able to accept the customer's word about their income and other eligibility requirements on the application. During this public health emergency time, the state is suspending Medicaid case terminations, so no one should lose Medicaid during the state of emergency. The state has also delayed the redetermination process. So redetermination is that point where once a year, consumers on Medicaid must renew or attest to their eligibility to continue to receive Medicaid. And so the state is not processing redeterminations at this time. Again, persons should not be terminated from Medicaid for failure to complete the redetermination process. If customers did receive a redetermination notice in early March, it may be important to still respond to that notice. And if they do end up losing their Medicaid, please reach out to HFS or reach out to advocates via Help Hub to help resolve those case issues. The state is also implementing an adult presumptive eligibility program for new Medicaid applicants. And so they will review the information, and if able to, they will presume that the person is eligible and therefore allow them access to care immediately while their application is processed and a decision ultimately made on Medicaid. You can find more information about presumptive eligibility on the department's website. Some of the program changes with Medicaid require approval from the federal government, from the Federal Centers on Medicare and Medicaid Services, also known as CMS. One of the applications for these changes is known as an 1115 waiver. And the Department of Healthcare and Family Services actually has posted all of this information and has some very helpful fact sheets on their website, and I've given you the link here. In short, what they are requesting with regards to the Medicaid program is to offer COVID-19 testing and treatment coverage for anyone who is uninsured, regardless of that person's income level. In addition, they are also requesting Medicaid be used as a secondary payer for those individuals or families who are insured, but maybe they have very high deductibles or their healthcare plans don't cover everything. And so this is all in an effort to make sure people have access to care when it comes to COVID-19. They're also waiving premiums and copays for all kids and the health benefits for workers with disabilities program. And there are some other flexibilities that they're requesting. Again, I refer you to the fact sheet for more information. And regardless if the federal government approves this 1115 waiver or not, the state has been very clear that they are committed to covering COVID-19 testing and treatment. So please make sure that those who are uninsured do not delay seeking care because of fear of being able to pay for that care. The state is committing to that. The governor has stated that in press conferences, And so our hope is that the federal government will approve this to allow Medicaid funding to be able to cover that. There are also some provider-related changes, and I'm not going to spend too much time on that, but this was done through the 1135 waiver. Again, more information available on the Department of Healthcare and Family Services website. But what they are doing with this is making it easier for providers who maybe haven't enrolled with the state Medicaid program before to be able to bill and get reimbursed for treating COVID-19 patients through the Medicaid program. Also relaxing some of the staffing level limits. When it comes to the Medicaid program, there's a lot of rules and regulations that providers must follow. It's not just a reimbursement issue, but a lot of other regulations. And so they're relaxing some of those during this time. They are also suspending prior authorizations for services related to this. And there's also some flexibilities when it comes to pharmacy type costs. So things like covering over-the-counter products for fever or pain, aches and pains that might be related to COVID-19. Also allowing a little flexibility and allowing prescribers who maybe aren't enrolled with Medicaid to go ahead and be able to prescribe that medication. You may have also heard a lot of news about expanding telehealth services, again, in an effort to keep people who maybe have signs and symptoms but aren't so ill requiring hospitalization, and also maybe for routine care during this time to expand the use of telehealth. If you're interested in more information about the provider-related changes, I would encourage you to check out the HFS website. When it comes to the ACA health insurance marketplace, there's been a lot of questions, can people access health coverage right now, private insurance? Let's say they're not eligible for Medicaid, but can they sign up for health insurance now? And most folks who are familiar with the ACA know that it's once a year during open enrollment in November and December that people are able to sign up for ACA health coverage. The federal government has not issued a special enrollment period for COVID-19 at this time. However, if persons lose health coverage because they've lost a job during this time, that does allow them to access health coverage through a special enrollment period. So a special enrollment period is for persons who have a qualifying life event, ultimately resulting in some sort of change. And what we are seeing right now are a lot of folks who maybe are losing that health coverage through a job loss and now are able to gain access to health coverage through the ACA. Please note, losing a job alone is not enough to qualify for a special enrollment period. There must also be a loss of health coverage because of that job loss. When it comes to unemployment insurance, I would point you to the IDES website. They are posting up-to-date information there. But when it comes to unemployment, I think it's helpful to understand that the way unemployment traditionally works is different from what some of the things that are coming down the pipeline due to the COVID-19 emergency. Traditional unemployment is usually available to persons who have worked in a job that qualifies, that kind of pays into the unemployment insurance system. And they have to have worked a certain number of hours in the quarter preceding their application and so forth. I'm not going to get into all of that detail because it is all available on the IDES website, but just know that that's how traditional unemployment usually works, in short. What has happened because of the COVID-19 emergency and some of the federal legislation that was passed in recent weeks are basically three kind of new expansions to unemployment. The first, pandemic unemployment compensation, is for those persons who were currently on unemployment. What it is doing is providing an extra $600 per week for those recipients, and that is set to go through almost the end of July. The second change that was made is known as pandemic emergency unemployment compensation. So those are for those persons who would be considered a traditional unemployment recipient. What it will do is allow 13 extra weeks of unemployment insurance for people who maybe have passed that 26-week maximum limit, which is what is usual with unemployment, is that you can only get 26 weeks. So it will allow people to receive up to 39 weeks of this benefit. They're also pairing it with that first one, and so these folks will be able to get the extra $600 per week. The state was supposed to start taking applications the week of April 20th for this. And the third is then the Pandemic Unemployment Assistance Program, and this is for folks who are usually not eligible for traditional unemployment. You may have heard a lot about the gig economy or self-employed persons. Maybe you have someone who cleans people's homes and it's just them, and they get paid cash for that. Or maybe you have a musician or an Uber driver or whatever the case is, that it's a self-employed person, or it's someone who maybe doesn't work in a job insured by unemployment insurance. And so this will provide benefits for this part of our workforce. One of the challenges with unemployment in Illinois is that the state's computer system, just in general for the first two types, the first two programs under unemployment, the state system has been very overloaded with the high volume of applications coming through. And in addition, the system is not set up to take applications for this third category, this pandemic unemployment assistance, at least as of today. The state is saying their target date for claims is meaning when people can apply. So for that gig worker or for that self-employed person who's lost work, the target date for them to be able to start applying is May 11th. And I realize that that doesn't help today if someone's rent is due and they need to, figure out something. But the state has said everything will be retroactive. And so to pay attention to that website and see when that announcement comes for when these kinds of claims may be filed. Another challenging part about unemployment right now is that all the local offices for IDES are also closed, and so everyone needs to file online. So I just mentioned some of the challenges we're seeing with the computer system. There is a phone number to try to call to, and unfortunately it's been very difficult for people to get through on that line as well, but to keep trying. And I've given you the link to the DES website here. One thing I want to note quickly regarding immigrants and access to unemployment insurance: as long as an immigrant has valid work authorization, and this includes DACA recipients, and that's the deferred action for childhood arrivals, as long as they have valid work authorization, are able to legally work, they may access unemployment insurance. And Legal Aid Chicago is one of our partner organizations, and they've developed an excellent fact sheet. They actually have two fact sheets, one on unemployment and some of these changes, as well as unemployment and the immigrant population. So I'd encourage you to check out their website. They also have a hotline. Now they serve primarily Cook County residents, but they do have an unemployment hotline that may be helpful. A few more points about COVID-19 related information that may be relevant to immigrant families. I think there's been a lot of challenge and fear for this population, especially as some of the policy changes that have been put into place regarding public charge and use of public benefits. And so what we can do is reassure these families that the U.S. Citizenship and Immigration Services has been very clear that anything related to COVID-19 testing and treatment will not be subject to public charge. And that includes if someone's able to access Medicaid for COVID-19 testing and treatment, that use of that benefit for this reason will not be subject to public charge. On the previous slide, I had just mentioned about immigrants and unemployment insurance and the need for a valid work authorization. And so just wanted to clarify that undocumented workers are not able to access unemployment insurance. And I know that this can be a significant challenge for families who maybe have lost work, if they were a restaurant worker or some other worker whose job has been lost or closed because of COVID-19. How are these families making ends meet? In some communities, there may be emergency funds available, and so one of our partner organizations is ICER, or the Illinois Coalition for Immigrant and Refugee Rights. They have developed a resource guide for immigrant families. It's a Google document so that they can continue to update that, and so I would refer you to that information to find out about some of the resources available. The resource guide goes much beyond just emergency funds. They talk a lot about even unemployment and some of these other benefit changes. In addition, people have had some questions about economic stimulus payments and so forth, and while this presentation is not going to get into that, I did want to point you to the National Immigration Law Center, which has developed a fact sheet on COVID-19 related relief bills and kind of the impact on immigrants. So I would refer you to their website as well for that. A few more resources. Please do check out the DuPage Federation's resource page. We've got two sections. We've got our regular resource page, and then we have developed a COVID-19 related page that we are trying to keep up to date as we learn more. So please visit us there at dupagefederation.org. And then Help Hub, I've given you the link here. If you are not already on Help Hub, I strongly encourage you to sign up. This is kind of led and administered by our partners at the Shriver Center on Poverty Law. It was born out of the ACA and was a resource for those navigators and certified application counselors and other enrollment assisters, but has grown to be much, much more public benefits related, not just strictly ACA or Medicaid. And so if you're not already on Help Hub, there's just a quick form to fill out. It is for providers, not for clients or consumers. And it's an opportunity for you to post questions, or if you're seeing a trend, a certain issue that keeps popping up for a client after client, this is the opportunity to raise it. And then our partners at Shriver, along with the DuPage Federation, EverThrive, Illinois, and Legal Counsel on Health Justice. There's a number of different partner organizations who will respond to those questions. You can also ask questions related to immigrant access to public benefits and public charge related questions and much more. Regarding food assistance, there is a group in Illinois known as the Illinois SNAP Advocates. This is a statewide network, so it's not just regional to the Chicagoland area. It is truly a statewide network convened by partners at Shriver Center and the Greater Chicago Food Depository. And once a month, this group gets together to discuss program changes, policy changes, SNAP advocacy efforts, and much more. If you are interested in joining this Illinois SNAP Advocates group, please email me, Kristen Hartsaw, at the DuPage Federation. I'll give you my contact information at the end of this presentation. And then finally, one more resource, and this is not an all-inclusive list by any means, but the Protecting Immigrant Families website. The website listed here, protectingimmigrantfamilies.org, is the national website. Please know that Protecting Immigrant Families Illinois also has a website, and all you need to do is add Illinois at the end of this. So it would be protectingimmigrantfamiliesillinois.org. Even if you do a quick internet search for it, I'm sure you will find that link. But this is a resource related to a lot of public charge related information, but also other immigrant advocacy concerns. So thank you. I hope this was helpful just to provide that quick summary. If you do have any questions or are in need of kind of public benefits TA at this time, you are welcome to email me. My email address is khartsaw@dupagefederation.org. I hope you are all well, and thank you for viewing.